right, welcome beautiful people. Thank you so much for watching my previous videos. I really appreciate all the comments, the likes. I'm so excited. All the people that subscribed, so thankful. Just to say, if you have not subscribed, kindly do so now. It helps me grow my channel, and it most importantly makes sure that when I upload a new video that you get to be notified. All right, so let's just get into it. My previous video, someone had asked the question for me to talk more about a specific type of dementia called Alzheimer's dementia. So what is Alzheimer's dementia? It is the most common cause of dementias. Remember, dementia is a clinical syndrome, is an umbrella term. We have different types of it. Alzheimer's just happens to be the most common cause. So in Alzheimer's dementia, there are two main proteins, beta amyloid and tau, that either forms plaques or tangles. So these proteins are typically found in the brain, but for whatever reason, when we look at beta amyloid, it forms these plaques, and it affects how the brain functions. So it affects information, blood flow, nutrients from one nerve cell to another nerve cell, and what happens? Brain cell death. And later on, tau accumulates, phosphorylated tau. It is also a type of protein, but in this case, it forms tangles. And when tau sets in, it acts as a sort of accelerant, and then makes the brain form more amyloid plaques. And then that is why it's a degenerative disease. It keeps on accumulating in the brain, and depending on where it accumulates, you see a deficit in that part of the brain. So if it is accumulating in the part of the brain where it typically starts is the hippocampus, then you see patients are forgetful. Okay, so that is Alzheimer's dementia. Let's delve into more of the signs and symptoms so you actually see. Now, just so you know, symptoms can start as early as 20 years, but it can be so subtle the patients may not really know. The main thing that patients typically see is being forgetful. So you may have a conversation with somebody and they just don't remember. They're forgetting conversations. And we hear a lot of trouble finding words, so word finding difficulty. I'll give you an example. So you're talking with somebody and they go like, oh, go get me that thing, that thing that you sit on. Instead of saying, go give me the chair. They're having trouble coming up with words. And in clinic, they describe it as, I know what I want to say, but I just can't say it. Or I know what I want to say, but it comes out different. It comes out in a different way. I want to say, okay, go get me a pencil, and they say something completely different, right? And so it bothers them. People notice it, and then hopefully they are proactive and they seek care at that stage. So that is just one form of it, one example, one sign of it. Trouble finding words. You find people being very repetitive in the questions they ask. So they say things over and over again, or they repeat stories over because they forget that they said it, and so they keep saying it. Or you tell them something, it does not register, and then what happens? They will ask over and over again. It can be so bad, unfortunately, that within a span of 5 minutes, they would have forgotten what you told them, and they'll ask you again. In the earlier stages, it could be like, a week, 2 weeks, even a month. You have a very important conversation, or you do something very significant, like go to a loved one's wedding or anniversary, or you celebrate with them one way or the other, and they have no recollection that happened. All these are signs that there's something going on. One thing I really don't like when people trivialize is, oh, they're getting age. It's just age. Don't ever say that. Don't just assume that everything is age related. I don't like it when patients use that, because then it makes them potentially miss something that could have been caught early on. So I don't like when people use that verbiage. If you see something that is concerning enough for you to mention it, make sure that you get evaluated for it. Okay, now then we talk about also executive functioning. So it affects their decision-making skills. You see someone who would not have paid for $60,000 for their windows to be fixed. Doing that, which unfortunately happened to one of my patients, they paid $60,000 for a company to change their windows, and they would have never done that. The windows didn't really need to be changed in the first place. They just got taken advantage of. So their decision making skills is affected. I had a patient come to me and say, oh, they're very given, they like to give, but then someone came to clean their house and they gave them a tip more than what the person charged for. So at the end of the day, they charged $200 for cleaning their house and they gave them a tip of $400. Their judgment is obviously off. Yes, people are kind, but talking to their family members, this is something they would have never done if they were not impaired in certain ways. So you see how their decision-making skills is affected. Visuospatial, they may be looking for their phone, their purse, their credit card is right in front of them. They just cannot see it. Why? It is because there is something going on in the part of the brain that affects that, causes that deficit. Okay, all right. And then also their attention are affected. You're having a conversation with them, they cannot really follow along, and when these things happen, patients end up being withdrawn because they realize that they're in the stage where they realize something is going on. So they become just withdrawn. They don't want to go for social activities. They don't want to go for parties or church activities. They don't want to gather with their friends. They don't want to go to restaurants with your friends because they want to say the wrong thing. They don't want to seem like or let people know that they're having something going on. And unfortunately, by doing that, it actually makes it worse. Yes, humans, we are social creatures, but for a reason. It is really good for the brain. Interacting with people, talking with people, it helps the brain, okay? Again, let's look at, so not only does it affect, that part of cognition, but it also affects the mental part as well. So you see patients become very anxious, they become depressed. It can cause agitation, and there's so many, there are different forms of agitation when we talk about dementia. A verbal agitation will be where someone who is very, pleasant and reserved, they lose their filter. They will just go off. They'll shout, they'll scream. They'll have emotional outbursts or emotional lability where they go from like they're fine one time and then they're like, 0 to 100. They're crying, just things like that. Verbal, it just comes out verbally. They're yelling, they're screaming. Physical agitation can lead to people, literally throwing, hitting, spitting, breaking things. There can be a physical, non-aggressive one where they're just, pacing back and forth, or restlessness. They pace back and forth. They move one thing from here to the other. They can complain a lot. They can be extremely negative. They repeat repetitive questions over and over again. They can call a family member 20 times in an hour, and I'm not even making this up. I hear this in the office. These are all forms of agitation that we see in Alzheimer's dementia, and it can also affect your personality. So some people can be, like I said, very withdrawn, but the opposite can also happen where they want to get into people's spaces. You go to a restaurant and they want to take, they just want to strike a conversation with, a total stranger. They just go to you and then they just start talking. That is not them. That filter is taken off. And some people will try to even just, take food from someone's plate, If they were not impaired in a certain way, they would not have behaved in that manner, okay? Now, in the later stages, unfortunately, it can get to a point where patients can't take care of themselves, they can't dress themselves. At this stage, that instrumental activities of daily living is already gone. They can't do their finances, they can't cook for themselves. They obviously can't take care of someone else. But in this stage, they can also take care of themselves. They can dress well, they can dress appropriately for the weather. They don't know you take pants, it goes this way. They will have the visual auditory hallucinations. They're seeing things, they're hearing voices. It can be fully formed people. It can be people who've passed along. It could be people who are not there, like in their states, but they see them. They have full conversations with them. To them, it's their reality. It is very real to them. So they hallucinate either visually or auditory. they get to a point where they can fall easily. So they when they start to fall, they start to not move much because they don't want to fall. And guess what? When you don't move much, you form blood clots. So unfortunately, it's a disease that just keeps progressing, affecting multiple parts of the body. Because again, the brain is a control system for the whole body. And then if you have these plaques accumulating in different parts of the brain, that causes cell death, then unfortunately these things happen. So if you don't take anything from this video, just don't say that forgetting things is normal part of aging. It is not. If you see a family member, a friend, if you're a caregiver, and you see these signs that I mentioned, make sure that they get checked out either by a primary care provider, okay? Because some cases can be so severe and worse that people get lost. That's why I don't recommend driving in patients with dementia, and it becomes a struggle. It's a very hard conversation to have when you tell them not to drive, because they forget what is gas, what is brake, different sensory inputs are coming. A car is passing by, someone is honking their horn, and it affects them. They become confused. Some people end up in a different state. Some people say, oh, I'm gonna go for a walk outside. They get lost. They park their car, they don't know where they park. They'll walk around it, and most of the time, the police have to get involved and help them to get home. So we really don't want it to get into that stage. And I educate people getting evaluated early on, because in that stage you can make decisions for your end time care. You can choose the person you want for your medical power of attorney, financial power of attorney. That way you make decisions when you are in the know. That way nobody will be making it for you when, quote unquote, you're not there, unfortunately. So seeking care early is very vital. And then taking care of your brain. You have to eat right. Exercising is the best thing you can ever do for yourself. Not smoking is one of the best things you can do for your brain. Your brain will thank you very much. I said it in my previous video. Making sure blood pressure is controlled is one thing you can really do for yourself as well. In the just in the interest of keeping these videos very short, hopefully I gave you enough information. There's a whole lot to this. I'm trying to give you the truncated form version as much as I can. And if there are, again, specific questions that's related to the brain, I know I brought up dementia because I just came from a dementia conference, but if there are any specific topics that you would like to know, or you want me to go through all the different types of dementias we have out there, just drop a comment in the comment section and I will address it in my next video. But most importantly, kindly like, comment, and subscribe. That way I can not only grow the channel, but also when I post a video, you will be alerted. So thank you once again, beautiful people, and stay blessed.